Welcome to the Clearly Beneficial podcast, the show where we rip off the Band-Aid and explore the future of healthcare, benefits, and the people driving innovation in the industry. This episode is brought to you by Health Next, the company leading the way in helping employers build enduring cultures of health and well-being, reducing medical cost trends, and increasing organizational performance. To learn more how they can help you, visit healthnext.com.
This podcast reflects the personal views of the host and guests, not their employers or sponsors. Hey everybody, this is Vincent Catalano, host of the Clearly Beneficial podcast, and today we're going to be talking about something that's going to affect everybody here in the next 6 weeks, and that is open enrollment. Well, most of you. I'd say 80 to 90% of American companies, small businesses, all renew their insurance policies for health insurance on January 1 for the 2026 plan year. So you'll be presented with information from your employer to take a look at evaluating your choices. And I thought it would be a good time to just share some insights on decision making that you want to consider as you go into this next cycle. First of all, the days of the open enrollment meeting are kind of over. Some small group brokers still show up and do an open enrollment meeting for small business. But for the most part, open enrollment meetings are, at best virtual, and at worst, your HR team, shoots you a PDF and says, here, read this. The thing is that according to the MetLife study, and this has been a consistent thing for many, many years, employees, take 9 minutes to evaluate or even read the 75-page PDF that they're given to look for at open enrollment. And so you're making decisions now for all of your things in 2026. And it probably is worthwhile for you to dig in a little deeper to make some positive and good decisions. This year in particular, health insurance rates have gone up double digits. So employers are sitting there making decisions and saying, well, do I pass some of that cost increase on to my employees? Do I eat it as an employer? Do I somehow share it? So that they're struggling with this because in some cases we've been seeing increases in the high double digits, 15, 20%, sometimes even more. Rarity is the case where, you're in the single digits because, hospital systems costs are going up. Insurance companies are, keeping their margins healthy. And who gets caught with this? And that's you. One of the interesting things that drives the cost of health insurance is the fact that hospital systems, they have this thing called payer mix, and you should know about this. It's something where, coming into the door of a hospital, you have people who pay them different levels for the same procedures, right? So you have someone coming in that may have Medicaid or Medi-Cal in California, Medicare, for people over 65, and then commercial pay. And then, of course, there are people who don't have insurance at all who don't pay their charity care. But when you look at the amount that gets billed from a hospital for those services, Medicaid, Medi-Cal pay them the least. Medicare pays them the next least, but the people who pay the most are commercial payers. So the brunt of increase in cost that a hospital has to fund for themselves generally gets put on employers. And by employers, that means via the insurance that employers pay. So this has been something that I've studied and have basically looked at over the last 20-something years. And on average, employer costs go up 9% a year. Now, this is going to be one of those outlier years where things are going to go up higher. So what can you do as an individual when you're faced with your open enrollment materials? How do you make a decision? Do you stick with what you had this year? Do you look at the changes? Because you got to be careful about how these changes are being presented to you. So there could be changes in your coverage. So the co-pays might go up, the deductibles might go up. You might be faced with the fact that the plan you had last year is no longer available. So you have to take a look at what the choices are and how those things, will meet your needs and your family's needs. But there's a couple of basics that you really need to understand. The two most important numbers, actually the most important number in the health plan is this thing called the maximum out-of-pocket maximum, however you want to phrase it. This is the number that if you are in a catastrophic situation that you and your family would pay. And once you've met that number, the insurance company pays for your coverage 100% for the rest of the year. Now, most of us will never hit that number, okay? Because especially, as if you have nothing going on and you're reasonably healthy, which describes, 85% of the population, you're never going to see the maximum out of pocket. And I think in my lifetime, me and my family have only hit that number one time, okay? But it's still an important number because it can cost you to the point of thousands and thousands of dollars. So a typical large group, if you work for a large employer that, depending on the state you're at, it could be 50 or more employees or 100 or more employees here in California, you could have an out-of-pocket maximum for you as a single person of $4,000. Doesn't sound like a lot, right? Or for your family of $8,000. But if you're in a small group plan for small business, those plans generally have higher out-of-pocket maximums, and those could be on the order of $8,000 or $7,000 for a single and twice that for a family. So you could be facing an annual out-of-pocket maximum of, $14,000, $15,000, $16,000, which is very high. So add that, the out-of-pocket maximum, to the amount of money coming out of your paycheck for you for your insurance, and that is your total cost of ownership for the year, potentially, in a worst case scenario, okay? So that is probably one of the most key factors you have to play. Everything else under that, which is the copay, the deductible, the co-insurance, all those things lead up to ultimately hitting that out-of-pocket maximum number. So you have to decide what's most important to you. Is it important to you to pay $40 when you go see a doctor? Or is it important for you to pay less for insurance? Because when you pay, take a plan that has a regular copay and a low deductible, you will pay more for insurance than the people who basically say, okay, I'm going to take a consumer-directed, high-deductible plan and pay less for insurance. And then what they normally do, which is a great strategy, is pocket the difference between what you would have paid for a rich plan and what you're going to pay for a consumer-directed plan and put that in a health savings account. Okay, a lot of people just say, okay, I'm just going to save the money. But the most important thing that someone can do in entering a high deductible plan is participate in HSA. Now, in some cases, your employer will contribute something to your HSA, and then it's up to you to put in the max. I mean, for a family in 2025, the number was $8,550. You can put into an HSA, and $9,550 if you're over 50, 55 years old as a catch-up contribution. So it is an interesting vehicle to be able to consider putting money away, because number one, the money goes in, it's tax deductible. It's your money, whether your employer puts in it or you put it in. There's no use it or lose it function of this. And then you get to, depending on the HSA administrator, for example, I use a brokerage account. I can invest that money in mutual funds, exchange traded funds, money markets, anything I want to invest in, okay? And then when the money comes out for valuable healthcare expenses, or when you turn 65 to pay for Medicare, parts of Medicare, or long-term care for that matter, that money comes out tax-free. So it's actually one of the few vehicles, the health savings account, that it benefits you tax-free going in, and it benefits you tax-free going out. So it's really something to take a look at. Now, what I do as a strategy is look at HSA and say, well, I'm just going to I just use it as another investment account, to be honest with you. When I have a doctor visit or pharmacy filling a prescription, I don't worry about my HSA. That money's just sitting there. The HSA is for a long-term strategy. Short-term strategy is to use just your credit card to pay for those out-of-pocket expenses, those low out-of-pocket expenses that you might have. So that's something definitely to consider. So look at your total cost of ownership. Look at the type of plan that you want to be in. So a lot of you get the choice of being offered an HMO, which is a narrow focused plan. You have a narrow focus of doctors. You have a primary care physician that acts as your gatekeeper to refer you to other specialists in your network. So those plans tend to be a little more restrictive from a network perspective. PPO plans, because of the fact that you now have the flexibility to go see the doctors that you choose to, PPO plans tend to be a little more expensive, especially when you're considering the same level of benefit. So if you have a plan with a $40 copay, a $1,000 deductible, HMO versus PPO, that PPO will tend to be more expensive. Now, one of the things that's a bit of a misnomer is that, oh yeah, I can go to any doctor I want with a PPO. And well, that's true, but there's in-network docs and there's out-of-network docs. So when you go to an out-of-network doc, the PPO almost operates as if it has a parallel health plan. The out-of-network component of it has a separate deductible, a separate out-of-pocket maximum than the in-network PPO. So it's something to keep your eye on, but it also gives you, and at the end of the day, if you want all that flexibility, if you feel that eventually you might want to go to the Mayo Clinic for something, having a PPO is definitely something to consider. You should think about what's going on with you and your family. When it comes down to the choice, are you all healthy? If you're all healthy, then being in a high deductible plan with a couple to an HSA makes sense. If you got a lot going on, it probably makes sense to take a look at what your total cost of ownership could be. Again, premium and deductible. If you're anticipating a surgery, a pregnancy, any of those things in 2026, all that should go into your analysis for what your total cost of ownership is. One thing also to make sure you're aware of is if, for example, there's some change in your plan, your employer said, okay, well, we're switching from X insurance company to Y insurance company. Well, things are going to change, right? The doctor network might change a bit. The pharmacy formulary might change a bit. And that's super important because if you're on a brand name drug in particular with insurance company, X, that same drug may not be available in insurance company Y. So a good rule of thumb is to make sure you fill that prescription for the drugs you're taking on the brand name right now today before the end of the year. So you have at least a 90-day supply going into 2026. And then talk to your doctor about what is a better drug to switch to. And drugs these days, and I'm going to be doing other podcast episodes with people in the pharmacy industry, so stay tuned for those. But drugs are an interesting thing because I know, example, my health plan, I take I take a blood pressure drug and I take a cholesterol drug. Okay. When I took a look at the cost that it would cost me through my health plan via mail order or for a 90-day supply, the costs were very, very high relative to an other out-of-network mail order choice. And I'll just name names, Mark Cuban's Cost Plus Drugs. I pay 1/3 or less of the cost of these generic drugs through that vehicle versus what I would have paid through CVS in my own health plan. So again, be a good comparison shopper. Think about the options you have to pay for the things. Okay, so checking your drug formulary, making sure the providers that you have are in the network if there are any changes, understanding the total cost is super important. Making sure that the family members you have on the plan are the ones you want on the plan. And no, you cannot put your grandmother on the plan. You cannot put your cousins on the plan. This is for you and your immediate family. So those are the people that are going to be on the plan. Now, this opens up a whole other interesting conversation about two spouses, both have employers, both have separate employer health plans. Okay. A lot of thought goes into I'll stay on my plan, you stay on your plan, we'll put the kids over here. It makes sense to do an analysis on both plans, what the out-of-pocket monthly premium costs would be to put the whole family on one plan. And why I say this is that say this one spouse works for a large company with a low annual out-of-pocket maximum, and the other spouse works for a small group that has small group plans. The person on the small group plans would probably have a higher out-of-pocket maximum than the family plan. So when you look at how these plans are structured, I hate to use this term, but it's kind of like the car crash scenario. Okay, family, husband, wife, 2 kids get into a car crash. Okay. Husband is on his plan, kids are on his plan, spouse, wife happens to be on the other plan. Okay. So what does that mean? Well, each three of the people will be covered by one insurance, the other one will be covered by another. That means you're building up separate deductible costs, you're building up separate out-of-pocket maximums, and therefore it could overall cost the family a lot more in out-of-pocket costs to have both spouses on their own respective different plans. So it really makes sense to do a little bit of a deep dive and understand the total cost of being on one plan together versus on separate plans, not just from a premium point of view, what's the least coming out of my paycheck, but in the bigger picture, taking a look at copays, insurance, and out-of-pocket maximums and deductibles, because that becomes an entrance into the total cost of ownership. Of course, you got to make sure you're adding or dropping the right dependents. And I always tell people, no one really pays attention to this, but you have a baby, make sure that kid gets added to the plan within the first 30 days, not the 31st day. Insurance companies are pretty persnickety about that detail. So this is just a general refresher on open enrollment. You're obviously going to have a lot of choices. I mean, literally, I wasn't joking when I say your HR people will send you a 75-page document, because they have to. There's all the disclosures, all the plan outlines. I mean, and not just for medical. You're looking at dental insurance, vision insurance, long-term disability insurance, short-term disability insurance, and all the supplemental benefits. They may be offering you pet insurance this year, which is a good deal. The one thing I want to really kind of point out to you as well is people discount. They look at all these benefits and they go, great, I got medical, dental, vision, life insurance. So there's a couple of points. First, life insurance, buying supplemental life insurance through your employer is the least costly way to bolster your life insurance for you and your family. That insurance company for your employer may have a guaranteed issue of a couple of $100,000 that you could buy at a very low cost for you and your spouse to be insured by that insurance company. So life insurance, it's very cheap, and it's cheapest if you buy it through your health and your employer, because there's no health questions under the guarantee issue number, and it's really no fuss, no muss. But the second most important insurance next to medical that you are offered, if your employer offers it, and if they don't, you should ask them to offer it, and that's long-term disability, or I like to call income protection insurance. Income protection insurance is all about protecting your paycheck if for whatever reason you're disabled. A lot of employers pay for it on your behalf, and you don't even know it's there. Okay. But a lot of employers may offer it to you on a voluntary basis, which means you could buy it yourself. This is the thing that is amazing about long-term disability insurance. Let's say you're bringing home, $6,000 a month. The long-term disability insurance will cover you up to 60% of that per month. And if the premiums are taxed, that means you get a tax-free benefit until your normal retirement age. So that could be, you can get basically, if you become fully disabled, you can get a tax-free paycheck up until age 65 or 67 or beyond. So long-term disability insurance is something you should pay attention to. It's super important. If your employer is paying for it, amazing, give them a hug. If they're not paying for it and they offer it to you as a voluntary insurance product, you should consider it, because it's probably the least costly, highest level of protection you would have in case something bad goes wrong. You're more likely to become disabled than you are to die. So it's definitely something for you to think about. So I think that covers, the high level of open enrollment. I mean, make the choices, make them on time. Don't be that person that your employer is chasing around. Did you log into the system and do it? Because a lot of you are just going to log into a link. You're going to click, you're going to go boom, 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 boom. And in many cases, your employer is going to do a passive enrollment, right? If they haven't made any changes to the plans, the only thing they've changed is the rates. They're going to go, okay, well, you have this, and this. So you want the same thing next year? Click here. Take a minute, take a breath, take a look at the details, look at what's there. Do you want to be on this plan that's going to cost you more out of your paycheck or less out of your paycheck? And then you get to fund that HSA. If you're young, okay, if you're Gen Z, if you're a millennial, you will thank me when you're 60 years old that you funded that HSA for the last 25, 30 years. Because all of a sudden you're going to be sitting there at age 60 with 200 grand in this HSA because you're probably healthy and you're never going to use it. And that is tax-free money that is available to you to pay for your health care into your long-term retirement and going on in your life. So keep in mind that HSA coupled to a high deductible health plan is an incredibly smart strategy. And yeah, something to seriously consider. So thanks for listening here about open enrollment. Good luck. And please share this podcast with anyone you'd like to share this knowledge with. I mean, the point of the podcast is to be educational, uplifting, and being clearly beneficial. That's the point of the podcast, right? So it's going to benefit you. It's going to benefit your friends. And for the 20 minutes you just listened to understand open enrollment, that's more information than your employer just gave you. So best of luck, and we'll see you on the next episode, which will feature author Judith Kunish talking about her book, Center of the Star, which is an amazing book, very well written, very accessible about the entire healthcare industry and how it works. And so excited to interview Judith and talk with her about her new book. So thanks again for listening.